Canephron N tablets is a diuretic of plant origin. The combined drug has a diuretic, antispasmodic, anti-inflammatory, antimicrobial effect. Indications: Canephron is used in adults and children in complex therapy in the treatment of chronic infections of the bladder, cystitis and kidneys, pyelonephritis, with non-infectious chronic inflammation of the kidneys, glomerulonephritis, interstitial nephritis, as a means of preventing the formation of urinary stones, also after removal of urinary stones. How to use: inside without chewing, drinking water. Adults 2 tablets 3 times a day. School-aged children 1 tablet 3 times a day. After the severity of the disease has subsided, treatment with the drug should be continued for 2 to 4 weeks. During treatment with the drug, it is recommended to consume a large amount of liquid. Contraindications: hypersensitivity to the components of the drug. Children age up to 6 years. Peptic ulcer of the stomach and duodenum in the acute stage. Lactase deficiency, lactose intolerance, glucose-galactose malabsorption. Sucrase maltase deficiency, fructose intolerance. Special instructions: with edema caused by impaired function of the heart or kidneys, the consumption of large amounts of fluid is contraindicated. With impaired renal function, the drug should not be prescribed as monotherapy. In the case of inflammatory kidney disease, you should consult a doctor for advice. In the event of blood in the urine, pain during urination, or acute urinary retention, you should immediately consult a doctor. Side effects: allergic reactions are possible. Possible disorders of the gastrointestinal tract, nausea, vomiting, diarrhea. If signs of an allergic reaction appear, the drug should be discontinued.